Well, Fox 45 continues to bring you to the frontline experts who are fighting COVID-19 on a daily basis. And after a year of the first known positive cases in Maryland, what have the experts learned? Well, joining us now for our Monday morning house call, Chief of GBMC's Division of Infectious Diseases, Dr. Theodore Bailey. Dr. Bailey, thank you again for joining us.
Good morning.
Good morning. So how does this pandemic compare to addressing other disease outbreaks that we've had?
Well, I would take flu as one that we have the most familiarity with going into 2020. And this really is so much more extreme than influenza. But what has it done to influenza? Well, we've seen dramatically, even historically low numbers of influenza cases. And that speaks to the idea that this transmitted in the same fashion, but not as transmissible, right? So even with our masks, even with our distancing, we've still been slogging through this pandemic, but with flu, it really dropped off. So it was much less transmissible, and therefore what we did to it really dropped it down. We've not had to fight with it much this year.
Oh, just going back the last year that you and I have talked just about the mask arguments right in the very beginning, to washing our hands, to social distancing, to trying to figure out exactly what's going on here. When it comes to, though, the way the medical, world will handle this, is it something like HIV and AIDS where all of a sudden we changed everything the way we handled, we just assumed everyone had it, and so it changed the protocols, the way that a nurse would even come into the room?
Well, that was part of one of the early transitions was some of the recommendations where we hadn't geared up our mask making and our PPE making, and we knew that it was in California, it was in Seattle and Washington, and there was a real reluctance to have nationwide uptake of these when we hadn't seen it in other places, but we did have places that were going to be fighting to have enough PPE. So then it did become an issue where, okay, we know it's everywhere, and also we're starting to gear up our PPE, and those recommendations come online to say, hey, we should all be trying this and putting them on. And I think we've settled into that now.
Right. And so what are some of the major surprises, I guess, that you've seen over the last year?
Well, I think one of them was, in a way that I think is everything is unprecedented in a sense, but one of the things that really stood out was the medical community looking to very early, very unmature evidence for what to do with COVID. So you saw a kitchen sink approach. It wasn't that it just lit a fire for research and to get research going and get the results. It was almost we wanted to do things before there was results to support them. And so we saw a number of medicines that didn't even make prime time thrown into patient care. And I think that that's probably something that where we treated COVID in a way we shouldn't have treated it. There's two parts to COVID, in my opinion. One of the things we learned is that there's the epidemiology, there's the epidemic of it, and there's all the urgency for vaccine and prevention. But at the level of the individual patient, yes, they're urgent, they're sick, they go into the ICU, but we see sick people. We see sick people for whom what we can do for other diseases is not yet what we want it to be. But we were doing things for COVID that had much less evidence behind them than the things that we would do for heart attacks or for strokes, even though we would like to do more. With heart attack, strokes, we're still waiting for more research. The NIH is funding it. But with COVID, we were really reaching and just trying. And I think that in some cases may have put patients at some danger earlier on. A year in, now we have, a variety of therapies that we can try that there's more evidence for. And, I think we've settled out of not looking to just some small publication out of one country to rely on for treating our patients.
Dr. Theodore Bailey with GBMC, we thank you so much for your time.
Okay.
Well, make sure you send us your health questions and suggested topics to news@foxbaltimore.com with the subject line Monday Morning House Call.